The issue of obstetric fistula is a failure of a system because it is the end of a suffering by women who need to have obstetric care and cannot get it. It is also the failure of a social system that does not provide adequately for their women. So you find that these women get married early, too early, to have children. And so their bodies are not ready. And so when they do get into labor, they also do prolong the labor and then they get fistulas. So it's about ensuring that we engage with member states, we engage with communities so that these women have adequate information, adequate education, maturity, and access to services that will cut fistulas. In Tanzania, we have a program working with the fistula patients to be able to get transportation to take them to care and for them to be able to get the appropriate attention which they need when they need it. Of course, in the future, we're hoping that these kinds of mobile technology that's available, and indeed that is probably the most ubiquitous technology that's available in the developing world, would be useful for prevention of fistulas in the future. The campaign against fistula and the way that we have used it and the way that it has worked out, we have used it as an entry point to talk about maternal health in those countries. And it is a wake-up call to governments and communities around the world that this is happening. In fact, in many places, I'm not sure those governments are aware of the enormity of that disease burden which they are carrying. I've seen fistulas as a doctor in Nigeria. I've seen what it does to them. It's not just about the inability to control their natural instincts. It's also about social isolation. So you find that those women cannot actually live within communities because they're isolated. You find that their husbands abandon them. And you find that society generally does not want to deal with them. So when you've gone through the process of repair and the women are back to their normal, it also requires you to actively reintegrate them, integrate them socially. The issue of health and the issue of social welfare is one which requires different stakeholders to participate. And in my view, government, of course, takes the lead because government provides that policy framework and also, in a sense, gives us what we need to do in terms of programming. But implementation and ensuring that it happens and making sure there's quality of care on the ground is about partnerships. Government, civil society, private sector, and indeed those communities themselves taking charge of their own health. So yes, of course, partnership is crucial. Certainly we can end fistulas, and it is about the sorts of things I talked about, engaging young women, making sure that they're mature enough, not giving them out in early marriage, and ensuring they stay in school till at least secondary education, and providing them the services which they require when they need it, close to them. I think that's what's going to do it.